hear people all the time buying peptides online, and it's scary. You cannot just biohack your way to health. Welcome to Regenerative Medicine Peptide Series. This Peptide Series was created to educate anyone who is interested in this new trend, peptides. It was triggered after reading an article on the Wall Street Journal, May 2026, where young men were turning to peptides in search of perfection. It is very important to understand peptides. I hear people all the time buying peptides online, and it's scary. You cannot just biohack your way to health. So this peptide series focuses on regenerative medicine, and it teaches you how to optimize your body to heal itself. I'm Dr. Joanne Balkaran from the Ankle and Foot Center of Central Florida. I'm a board-certified foot and ankle surgeon, wound care certified, and a fellow in minimal invasive surgery, as well as peripheral nerve surgery. I'm also peptide certified by the SSRP. But although I'm certified in surgery, I have become the non-surgical surgeon, helping patients' bodies heal themselves and utilizing surgery as only the last resort. This has been through my own personal journey, healing myself from injuries that I now impart to my patients. So my approach to medicine and treatment has always been a non-conventional way, a non-conventional approach to establish the root cause. I've had the privilege to experience education and medicine in the Caribbean, Trinidad, Canada, US, and Europe. And my goal is always to establish the root cause and work backwards, whereas modern medicine aims at symptomatic management and treatment. As doctors, in our training, we study diseases and how to treat them and possibly reverse it. Is this the best way to learn? If you want to become rich, do you study from the poor or do you seek mentorship from a billionaire? Why are we studying diseases instead of studying the healthy? Why aren't we taught how to stay healthy and maintain health? Why aren't we imparting that to our patients? Why aren't medical schools' foundation based on studying the blue zones, the longest living, healthiest areas on earth where these people live? Using that knowledge to educate and teach patients health and not focus on treatment medicine. But the truth is, your body can heal itself given the optimal environment. My body healed itself. So let's emphasize on preserving health and understanding your body's capacity to heal. So in this series, we focus on aging, cellular efficiency, mitochondrial health, and what happens to cells under stress. When you go to the doctor and your labs are in the normal range, that's a lab scale. But when it's optimized, that means it's functioning to its fullest. Let's optimize you. Your body's constantly remodeling and turning over cells. So as a surgeon, with fractures, I reduce and fix fractures and align them to heal. But some end up in a non-union, not healing. Why? Muscle strains and ligament sprains can heal once anatomically aligned, but sometimes they don't. Why is this happening? Wounds heal on some patients, and on others it becomes delayed and chronic, and an ulcer can persist for months, years. Why is this happening? I always ask these questions as I was trained to prescribe medications or surgically treat. Is this truly the way? So peptides can help, but not replace. It is important to address what's happening to the body and its environment. Why and where is there an imbalance that's preventing it to heal itself? Why we look, and so we look at your diet. Are you getting healthy sleep? Are you stimulating your body with exercise? And how is your mindset? It is imperative to decide if the underlying issue is inflammation, metabolism, or immune issues within your body. So as you dig deeper into these areas, it guides you on where the dysfunction is in the pathways that will eventually lead you to the peptides that are most appropriate to use to optimize your body to get back on track. So what are peptides? Let's discuss what this is about. So peptides are naturally occurring signaling agents within our body. After the age of 30, the signaling agents decreases and continues to decline over time. It is why as you get older, you take a longer time to heal or recover compared to a child, where they can fall and get up and recover right away. Peptides are endogenous signaling tools that restore homeostasis. They consist of short-chain amino acids combined by a peptide bond. It is not long enough to consider a protein, and it is synthesized by the ribosomes via the mRNAs. They can act as molecules for receptors, enzyme production, or a signaling pathway. So there are over 7,000 naturally occurring peptides in our bodies. But the peptides that you see outside that are sold are synthetically made to mimic these endogenous peptides or protein fragments within our body. Most peptides are not FDA approved, and this is important that you tell your patients that if you're dispensing peptides. And some example of FDA approved peptides are, everyone knows, insulin. Insulin signals your body to absorb glucose from the blood. Then there's glucagon. So glucagon is the glucose that's stored in the liver, and it signals the liver to convert glucagon to glucose when energy is needed. Then there's oxytocin. It's a chemical signal in the brain that stimulates uterine contracture in childbirth. It also works on lactation, social bonding, and in stress regulation. There's glutathione, which is an antioxidant signal agent for detoxification and cellular protection. And then we all know the GMPs, Ozempic, semaglutide, and this was approved for diabetes and weight management. So peptides typically have a short half-life. That's why they have to be taken frequently and cycle. They come in, they work, they signal, they work, and they exit. And they target cellular function and signaling pathways to optimize the cell so the cell can do its job in the best way. They do a number of functions, and we'll go through some of them so you understand why different peptides work for different aspects. So they modulate immunity, they support metabolism as well as inflammation. They support cell senescence, and this is something we'll discuss later, what that is. It's very important. They help with fat loss and gaining muscle. They aid in recovery and healing of muscle, bone, tendons, and ligaments. They help us fight infection. They aid in nerve health and regeneration. They preserve collagen integrity. They minimize scarring called fibrosis within our organs. They're used to treat anxiety, depression, and cognition in the brain. They assist in sexual wellness, mood, and sleep. And they help improve recovery from training and injury. So overall, they assist in cellular health and longevity. So the reason why peptides are everywhere, that you can buy them online and they're everywhere, is because they're naturally occurring in our body. And the patent law basically states you cannot patent something that already exists in nature. You can only patent a human invention. So you can only patent a human invention. Naturally occurring peptides already exist in the human body, so no one invented it. It's considered a scientific discovery. So please be careful when you buy and stack peptides on your own. Although it may feel good, you might be signaling pathways you should not. And you can also be overstressing your cells. And this can lead to other unforeseen serious issues. Peptides should only be sourced from 501(c)(3) compounding pharmacies. They comply with FDA rules, or 503(b) outsourcing facilities, and they are inspected by the FDA but comply with the Good Manufacturing Practices, GMP. So remember, as a doctor, physician, healthcare provider, before implementing peptides, first evaluate the patient's cellular environment. What is their diet like? Is there movement or exercise in their life? Are they getting sufficient sleep? What is the rate of their stress levels? And secondly, understand the pathway that is affected and the most and systematically optimize the patient to prescribe peptides in the right way. You need to order tests, track and monitor pathways, find a certified doctor, and ensure sourcing is approved. Then maybe use the right peptide for the overall cell function at that time. So I hope this was helpful, I thank you very much. You can follow us at the Ankle and Foot Center of Central Florida. And for more information, you can also join me and follow us at the Regenerative Summit. Thank you.